So let's do the inferior aspect of the skull. Let me set it there also. Okay then. So yes, we are set with this. Let's start with here. Okay, let's start here. What do you see in the posterior aspect, inferior aspect of the skull? Okay, when you look at the inferior aspect of the skull, you roughly divide it into three parts. The part that is at the level of this posterior margin, you make rough lines at the level of the this. Let me open the book side by side, so it will help me also. Where the palatine bone ends, palate ends, and where the foramen magnum starts. Okay, where the foramen magnum starts. Let me. Okay, let's start here. Okay, let me change the color. So, this part. Oh, I hope so. I will get more smooth over the things over the next lectures. That is a part of the reason I'm doing these things to at least straighten my hand out. So you can make these parts that are not anatomical division, that are just to easily describe the things. Let's The hard palate is in front of it, then we will see what is at the back. Oh, I just remembered that we did not discuss external occipital protuberance. Okay, we will cover that also. So let's see what is the hard palate. You can see from the color coding, the hard palate is made up of two bones. The one shown in the green, that is the maxillary bone. The maxillary bone, this is called the palatine process of the maxillary bone. And the one shown in the this red orange, that is the palatine bone, that is called the horizontal plate of the maxillary of the palatine bone. So between them, four sutures will be formed. Let's move to the 3D model. So here, let's see here. So this one, this bone and the anteriorly, that is the maxillary bone, and the part that is forming the part of the palate, that is the palatine part. Here was the maxillary arch. Here is the palatine plate, and then there is this horizontal plate of the palatine bone. Okay, so between them you can see sutures. There is a suture between the horizontal plate palatine process of maxillary bones. There are two maxillary bones. There is a intermaxillary suture. The suture present between the two palatine bones is called interpalatine suture, and between maxillary and palatine bone, that's common sense will say, that is, as common sense will say, it's the palatomaxillary suture. Okay, you have to see a few landmarks, that a few important things that are present here. First, this opening. I will discuss the three openings that are present here. This opening, that is called these openings: opening number one, opening two, and opening three right here. So this opening right here, this is called the incisive foramen. Incisive foramen leads to a pair of canals, incisive canals, that the right one goes to the the nasal cavity, and same for the left one. Then there is a this greater palatine foramen. Greater palatine foramen, it's present between in the suture of the palatine and maxillary bone, and it is containing the structures with the same name: greater palatine artery, nerve, and veins. and in fact, and then in the posterior aspect, that is in the basically that is the pyramidal process of the maxillary palatine bone. You see that that is the same pyramidal process that was seen here in the pterygomaxillary fossa. Oops. So a minute. So this is the called the lesser palatine foramina. This is the opening within the bone that is not present between the sutures, that is present within the bone, and it contains the structures by this name again, the the lesser palatine structures and vessel. So what is this structure? This structure is called greater. This contains the. I will go to the structures passing through the opening in a little while, and so this is the great incisive foramen, and it leads to incisive canal. So let me. Okay, moving on. Here you see this prominence. The prominence you can see right here. This is the posterior nasal spine. Let me show you here right now. That is called the posterior nasal spine. It is shown right here. Okay, so this is all about the palate, and here you can see these are the pits and grooves. Here the gum is very strongly attached to the hard palate here. So gum is very so the mucosa is very high, attached to here. So it shows the pits and grooves for the attachment of mucosa here. So this is about the hard palate. We discussed the four bones, two maxillary, two palatine. We discussed the four sutures, three sutures, intermaxillary, interpalatine, and palatomaxillary. Three openings, incisive to the nasal cavity, greater palatine and lesser palatines, and this posterior nasal spine. Let's go to the back. What you can see in this part. Okay, here you can see the posterior nasal septum. Let me get you. So this is the nasal cavity. We're seeing upside down, so it may be a little confusing. So this is the nasal cavity, vomer bone. If we were looking at this, we almost in the posterior aspect, we don't see the perpendicular plate of the ethmoid bone, we see only the vomer bone. In this aspect, we see these a pair of bones that are the part of the sphenoid bone. A lot of sphenoid bone is seen here. That these two plates, let me get it straight. So these plates, they are very nicely seen in the lateral aspect that I have just said. These are called pterygoid plates. Pterygoid process, the whole of it is called pterygoid process, and it is further divided into two plates. It is joined anteriorly, and it's in towards my face is the anterior. It is joined anteriorly, and posteriorly there are two free plates. So here you can see it is the two plates. So these are known as medial pterygoid plate, lateral pterygoid plate, and in between them there is fossa, pterygoid fossa between them, and the pterygoid fossa present between them, and the medial one contains this prominence that is known as hook of Hamulus. Um, do tell me know if I'm losing you or if I'm making things too complicated. Do let me know so that I may adjust accordingly. It's very a little unnatural for me to just talk to the recordings, but inshallah I will grow with it, inshallah. So here the sphenoid bone, you can part of the see the pterygoid plate of the sphenoid bone, you can see here. This is the greater wing of sphenoid. Um, right here, the expanded part, the part we saw on the lateral aspect, the part that is this was the infratemporal crest, and this is the part that contains the two openings that you read, that you studied in the anterior aspect of the skull, that was foramen ovale, foramen spinosum. And you see a part of the body of sphenoid here. It is right here, this part where the mouse is, this part, like this. So this is part of the body of the sphenoid. The difference, the suture is shown between the part of it and the part of the base of the occipital bone, but in practice it's usually very vague and usually not seen. So that is about the sphenoid bone on the inferior aspect. So what I have talked about it by now is that in the midline you can see the vomer bone, it's independent, there is no ethmoid bone. Here you can see the two part plates of the palatine bone. They're joined anteriorly and free posteriorly to form the medial and lateral pterygoid plates. So this is the lateral pterygoid plate, this is the lateral pterygoid plate, this is the medial pterygoid plate, and in between them. So let's take the parts of the sphenoid bone. Let's check if we have covered all of these. We have this whole of it is called pterygoid process, and it contains this medial plate, this lateral plate. The medial plate has a downward extension, this one that was called humulus, and lateral plate does not have a counterpart expansion, and the fossa that is present between these two, these are known as pterygoid fossa. The whole of this part that is present between these two, this space, this space that is present between them, that is pterygoid fossa. So there is a students ask me what is the difference between pterygoid fossa and the scaphoid fossa. So here the thing that is present between the two plates is pterygoid fossa, but if we trace the medial pterygoid plate up, it is dividing into two parts right here. So the point between these two, that is the scaphoid fossa, and the present that here, that is the pterygoid fossa. So that is known as pterygoid fossa. So these are the fossae that are present here. Pterygoid plate, here is the pterygoid humulus, you can see right here, and medial pterygoid plate, lateral pterygoid plate, the rest you can make it up. the Let me show you how to make things up. The medial pterygoid plate is medially related towards the internal opening of the nose. The lateral aspect of the medial pterygoid plate is related to the pterygoid fossa. The medial aspect of the pterygoid plate is related to the pterygoid fossa. The lateral aspect of the lateral pterygoid plate is related to the infratemporal fossa. So you can make all these things up as you go along. So let's see what we can see on the rest of the sphenoid bone. On the rest of the sphenoid bone, you can see here these openings. This opening that is called the foramen ovale right here, and this opening that is called foramen spinosum. I will go into the for the structures that are passing through it. Here at this point you can see the margin, the groove bed that is present between them, that is called tubal groove. That, can you guess which tube will be present here? The cartilage of the escutcheon tube will be present here. And the rest, the important landmark is this infratemporal crest. And then if we move front, we will go to again to the same pterygomaxillary fissure, pterygopalatine fossa, and we will go to the same infratemporal fossa, and all the same things will be here. So which junctions it is making? Let's just keep it simple. It is making junction here with the occipital part of the bone, with the basio-occiput you discussed in front in the neuroanatomy. Here it is making a junction with the petrous part of the temporal bone. This hole is the petrous part of the temporal bone, and in this fissure there is an opening groove for the escutcheon tube, and you will see this opening for the escutcheon tube opening right here. Let me try isolate that opening right here. You may be able to see the opening of the where escutcheon canal will exit. And any landmark I'm missing, can you help me with it? So this is it, and here is the spine of the sphenoid. Let me, it's right here. It is not, I'm not very able to, like, sorry, it's right here in front of the foramen. Let's now, let me, give me 1 second. I want to, it's better to appear naive than wrong. Spine of sphenoid, it's right here. It is very well shown in the Netters atlas, just behind the foramen spinosum, because it's beneath the foramen spinosum. So that is the spine. And here I may be or may not be able to show you right now, but you get the idea. This point, it's not very prominent right here, so let's stick with the that with the the Netris picture. So this point is foramen spinosum, the point behind the for spine of the sphenoid bone, just behind the uh, so we had discussed this groove for the pharyngotympanic institution, auditory tube, the opening for the auditory tube. There is a petrosphenoid groove we discussed, and on the lateral aspect there is the same things that will be shown the bone, that will be the part of the temporal bone, that is the fossa. Oh, sorry. That will be the fossa for the mandibular fossa, and behind it, here you will see the tympanic plate. You can see it is a roughly C shape. It is majorly covering the anterior aspect, inferior aspect, and part of the posterior aspect, not the whole. So this is the tympanic plate. Uh, this thing is tympanic plate. So the tympanic plate you can see right here. So what else can you see? You can mention in the comments what else can you see. If I'm missing anything, do ask and do correct me. um, this is the mandibular fossa, tympanic plate. So let's move on to the parts of the petrous bone. Okay, and we have uh, this opening, this opening front in the opening. Let's start with the foramen lacerum. This is the foramen lacerum. This is the opening between the two bones. It is present behind the sphenoid bone. It's anteromedially there is a sphenoid bone. There is a pterygoid process, and there is a body of the sphenoid medially, pterygoid process anteriorly, and the posterolaterally there is a apex, the tip of the petrous bone. One more feature, petrous bone is triangular. It's this point is pointed. It is making sutures with sphenoid bone anteriorly, squamous part here, and the occipital bone right here. And it is making two grooves with each of the sutures. Here it is making the groove for the uh, between the for the escutcheon tube. Here it is making the groove for the escutcheon tube. Here it is making the groove for the inferior. Here it is making the jugular foramen. You will see right here between these two parts. You will see jugular foramen right here. What openings can you see? Openings that you will be able to see right here should be this canal. This is the carotid canal, and just give me a second. Thank you for waiting. Sorry for the interruption. Let's start. और यहाँ बैक पे आपको क्या नजर आ रहा था? हम यहाँ कैरोटिड कैनाल देख रहे हैं. Carotid canal ये वाली है, carotid canal, and then there is a just let's mark the three openings. Here is the carotid canal. This one is the jugular foramen, and you don't see it in this view, but let's rotate our model a little and you will see this. This is an opening that is present between the two processes. This is the styloid process in front and mastoid in behind, so that is the stylomastoid foramen. That is very important because facial nerve passes through it. So these are the structures, major structures, the major structures that are aspect on the this aspect of the base of the occiput. You can see this. This is the, let's see on the netters. What does netter say? So so we have seen the plates. So let's see. So we saw the zygomatic process, articular tubercle. We have seen the mandibular process, styloid process, petrotympanic fissure. I did not discuss with you. Um, this is the petrotympanic fissure. You can guess by the name of the two things. Let me Okay, this is a petrotympanic fissure. That is the petrous part of the temporal bone and the tympanic plate. Right here. Let me show you concomitantly. Here, it is a petrotympanic fissure. Go to here and this point. This point that is present between this groove. This is petrotympanic fissure. Just remember the name. We will discuss it then. We will discussing the chorda tympani, how the different structures get out of it. This is the petrotympanic fissure that has a small opening shown right here. Small opening shown right about here that gives the opening of the nerves that are passing through it. I'm not going into the detail here, but that is the petrotympanic fissure. So what else do we have to discuss? Carot would discuss the carotid opening canal, tympanic canaliculus. I did not discuss with you. Tympanic canaliculus will be the tympanic canaliculus. I did not discuss with you. It's an opening just behind the carotid canal that also goes to the middle ear. Then there is external acoustic meatus, mastoid process, talomastoid foramen, and the facial nerve moves through the groove that a muscle that is passing through it. For there is a mastoid digest groove here, and that is for the I'm a little blanking. That is the occipital groove. That is the groove for the digastric muscle. Uh, petrous bone. We have discussed the foramen, jugular foramen, all that. Let's move on to the back part. It is very little things that you have to actually remember. Mm, So let's jump into them. Okay, let me try to get it as I want. Yes, it's of my liking. Okay, so this part that is fusion of the sphenoid bone in front and the occipital bone in the back, that is the main part, that is the basilar part. Basilar part of the occipital bone in front, it is fused with the basilar part of the temporal bone. Okay, this raised portion in the midline, this is the pharyngeal tubercle. You will discuss that in the pharynx when we will discuss the attachment of spiropharyngeal constrictor and the pharyngeal fasciae, and the two raised portions that are known as condylar processes. Occipital bone is there, so this is known as occipital condyles. The big opening between them, that is known as foramen magnum opening, big opening. And there is this vertical line that is known as nuchal line. Sorry, that is known as external occipital crest. External occipital crest, nuchal line horizontal वाली थी, that is external occipital crest, vertical line होती है, anteroposteriorly run कर रही है. This is the point जहां मेरा इस वक्त कर्सर अगर आपको नजर आ रहा है. This is the point. This is known as external occipital protuberance. अगर आप बैक पे फिट करें अपना मिड लाइन के अंदर, अपने आप को पैल्पेट करें, एक बड़ी मिड लाइन के अंदर रेज सी स्वेलिंग आपको फील होगी, बड़ी प्रोमिनेंट फील होती है. दैट इज नोन एज एक्सटर्नल ऑक्सीपिटल प्रोटूबेंस. उसके बाद एकदम से स्कल अंदर टिप कर जाएगा एंड यू वॉन्ट बी एबल टू पैल्पेट द बोन. सो दिस इज दैट पार्ट. This is the demarcating between the posterior aspect of the skull and inferior aspect of the skull. This is the external occipital protuberance. The lines that are running parallel to the posterior aspect, external occipital protuberance, these are known as superior knuckle line. If you move down the external occipital crest and the lines parallel, and in this area basal part, this is known as inferior knuckle line. And there is also higher knuckle line that is seen in the posterior aspect. I will get to the 3D model shortly. Three major openings you can see here. The opening foramen magnum, that is the major one. The major opening that is in front of this occipital condyle, that is the hypoglossal canal for the hypoglossal nerve. And the small opening that is behind, that is known as um, this condylar canal, condylar fossa. Sometimes in some books there's anterior condylar, posterior condylar is mentioned, that is talking about the hypoglossal and the condylar canal respectively. Because we have given it name the hypoglossal canal, we usually don't say the anterior posterior aspect. And there is one opening that is seen here between the squamous part of the temporal and the squamous part of the occipital and the temporal bone in this suture, and the mastoid part that is that is called the mastoid foramen. There is emissary veins that are joining the superficial surfaces to the sigmoid sinus internally. So let's move to the skull. Let me get a more feasible view. So this is the skull here. So here you can see the basal part just in front of it, two condyles. If we see on the anterior aspect of the condyle, here you can see the hypoglossal canal. This is the hypoglossal canal right here. So hypoglossal canal you can see here. On the back aspect, here you can see the posterior your condylar canal. Then I will show you the mastoid process, mastoid opening. It will be present somewhere over. Let me Here you can see here it is not drawn in the suture, it is drawn in the mastoid process. This is the mastoid foramen. Okay, let me go into the posterior view to better understand the external occipital protuberance. Let's get to here. Yes, so we are right here. So this point, the part that you make prominent, that you can feel right here, this is the external occipital protuberance. This part is the external occipital protuberance that you can see right here. External occipital protuberance. The lines that are demarcating from each sides that are known as superior knuckle lines, that are here that are known as higher or supreme knuckle lines, and the one not clearly seen in this view, but if you tilt the skull the little here, you can see that these, you can see inferior knuckle line. You can see this inferior knuckle line right here, and external occipital crest is visible right here. So this is about the base of the skull. What's the time right now? It's almost time. So we have discussed the inferior view of the skull, um, and all of the features. So let's take all the things we have done. We have done hard palate, maxillary and palatine parts, the sutures that are present behind them. Coena. Coena is the posterior nasal aperture. We did not do the boundaries of this. So this is the posterior nasal apertures. We will again do in the inshallah um, part, in the nasal part. So this is the posterior nasal aperture. You can make the boundaries from the picture itself. So which structures are making it? Inferiorly, there is a palatine bone, the horizontal plate. Medially, there is a vertically palatine part. Laterally, there is the medial plate, free margin of the posterior free margin of the medial plate of the medial pterygoid plate, and upper end there is the body of the sphenoid bone. So these are struck making the posterior nasal aperture, or otherwise known as coena. Then we discussed the pterygoid plates, the pterygoid fossa, the scaphoid fossa, pterygoid fossa, the scaphoid fossa, pterygoid plates, pterygoid humulus, the lateral part, the squamous part, the two openings here, the infratemporal crest, the sutures present here. When we moved on to the temporal bone, before moving on to the temporal bone, we discussed this fossa, this groove for estrogen tube, opening for estrogen tube, then discuss the foramen lacerum, its boundaries, and the petrous part, opening for carotid sinus. Just behind it, there was tympanic canaliculus. This was Starlight process. There was tympanic plate. Just ahead of tympanic plate, there was petrotympanic fissure. Just ahead of that, there was fossa for the mandible. Condylar process of mandible, there was external meatus. Then between the mastoid process and this was stylomastoid foramen, and the groove just behind it, containing the digastric muscle, mastoid was. And moving on to the posterior aspect, we saw the uh, occiput, pharyngeal tubercle, occipital condyles, anterior posterior foramina, that was for the anterior was hypoglossal, posterior was condylar canal. Then there was external occipital crest, external occipital protuberance, knuckle line, These were inferior knuckle lines, and the higher one did not discuss with you in the basal part. I think I don't have the picture right now. I can add it later. So there were higher knuckle lines. So all of these, I hope these have been covered.